The topic is descriptive epidemiology. The epidemiological methods are of two types. One is observational and then experimental. The epidemiological methods are of two types, observational and experimental. Experimental is also known as interventional studies because in this the researchers will make some interventions, whereas observational studies are known as non interventional studies because here the researchers only observe, they do not intervene anything. So epidemiology methods are of two types, observational and experimental. Experimental is also known as interventional studies, and observational studies are the non-interventional studies. Observational studies or non-interventional studies and experimental studies are the interventional studies. Now, this observational studies are of two types. One, descriptive studies, and then analytical studies. Epidemiology methods are of two types, observational and experimental. Then observational is of two types, descriptive and analytical. Okay. Epidemiologic methods two type, observational or the non-interventional studies, experimental or the interventional studies. Then the observational studies are of two type, descriptive and analytical. Let's see about the descriptive studies. Descriptive epidemiology deals with the time, place and person, the time distribution, place distribution, and percent distribution of the disease. The steps in descriptive epidemiology are: first, defining the population. First step is defining. The first step in descriptive epidemiology is defining the population, like who is at risk. Then defining the disease, that is setting inclusion and exclusion criteria. So while defining a disease, inclusion and exclusion criteria are required. For example, the inclusion criteria of diabetes mellitus. Diabetes mellitus का inclusion criteria क्या है कि fasting blood glucose should be greater than equal to 126 milligram per deciliter, or the random plasma glucose should be greater than equal to 200 milligram per deciliter. The 2-hour plasma glucose should be greater than equal to 200 milligram per deciliter. HbA1c should be greater than equal to 6.5%. So these are the inclusion criteria for diabetes. So while defining a disease, we have two things, inclusion criteria and exclusion criteria. Then describing the disease. Describing the disease in terms of time, place and person. First, defining the disease. For defining the disease, we have two criteria, inclusion criteria. Inclusion criteria, that is the conditions required for diagnosis, and exclusion criteria. Exclusion criteria is the conditions that rule out the disease. So first define the disease, then describe the disease in terms of time, place and person, and then measurement of the disease. Measurement of the disease in terms of incidence, prevalence and mortality. Comparing the disease with the known indices. Known indices means the past reports, comparing it with another region, comparing it with last year data, comparing it with other time or other region. And then last is the formulation of hypothesis. So what are the steps of descriptive epidemiology? First, defining the population, then defining the disease, setting the inclusion and exclusion criteria, describing the disease in terms of time, place and person, measurement of disease, comparing the disease with the known indices, and finally formulation of the hypothesis.